Namaste. Welcome to your prenatal asana series. We are practicing Janu Sanchalan or knee movements today. This is one asana that can be done in various variations and can be suggested to a pregnant lady depending on her condition. Now, there are certain precautions that need to be taken care. If the woman is in the third trimester, it can be sometimes either uncomfortable or almost very difficult to lie down on the back. So the movements of the knee can also be suggested while sitting on. And if she's comfortable, you can suggest that she can lie down in the supine. In third trimester, always keep the knees bent and try not to stretch both legs together at most times. And in first 2 trimester, it is mostly going to be comfortable. If the normal pregnancy is completely normal, there is no other precautions that is required, except if there is dizziness and she feels while lying down for a longer period, her dizziness increases. So in that case, you can avoid the asana. Now, while sitting, the way you can practice is simple movements of the knee, one leg on the floor, and then you can bring close and down, bend it and down, bend it and down. This is simple movement that can be done while simply sitting down. Now, she can also bend one leg and straighten another leg and gently press it towards right and left, bring it up and down. This movement can be done very simply, even while sitting. Now from here, I'll show you various versions that can be practiced while in supine. So as I'm in my third trimester, it's important to remember to lie down either through your side or while your knees are bent, whatever is comfortable. Once you're here, the first movement in Janu Sanchalan is you bend your one leg and other leg is straight on the floor, and then you just gently inhale, exhale, inhale, exhale. Or you can even keep the breath normal and just keep the movement on, off, one leg, and then shift to other side. This is first variation. The second variation is where both legs can be bent, and then we bend both legs together. And in this case, it's good to spread the arms wide. One side, the other side, and come together. Now the third variation is when you're going towards your side, you can keep both knees together, but then when you're going towards your side, you can spread the legs a little bit. Now this depends really on the comfort of the woman practicing it, especially in the third trimester. Be careful on her comfort zone of how much she wants to bend, how much she wants to stretch and open her body. It's always important to remind her and be mindful of her own body, her own stretching capacities, and not to overstretch at any point in time. So let's suppose you're turning towards your left, then you can open the legs a little bit. And doing the same on the other side, while your legs are a bit spread. until here can still be comfortable until third trimester. But the next variation should only be ideally suggested in first 2 trimester. As the belly grows, stretching further can be a little difficult for the women. So in this variation, you just cross the leg and then bend to the one side. Come back, cross on the other side, bend on the other side. And come back. Now the next variation is where bring your hands back, put one leg on the other knee and hold wherever she can. Depending on the size of the belly, especially in third trimester, this can be difficult. So you can either avoid it in third trimester or allow her or her own comfort to do this. If she's not able to lift her leg, other leg, it's okay to even just give it a slight stretch over here just by being in this position. If she can, in first and second trimester, you can ask her to lift one leg, just gently bring it towards her belly. Not too much stretching, just slight stretching, giving a stretch to this leg and to this leg as well. And repeating on the other side. Always staying mindful of the belly and always creating enough space for the belly. And releasing. The next simple variation can be the both knees is bent. Now you will just gently open a little bit and bring them together. Open a little bit, bring them together. Open a little bit and bring them together. Now, if the woman is comfortable, she can go further away into butterfly within this. Here. This can help relieve a lot of back pain and stress in the lower back, open the pelvic area. Just be careful if the woman is in her first few trimesters, first or second, and she have a cervix stitch to avoid the premature delivery, then not to do this because this touches the pelvis area. Otherwise, this is very relieving, so you can even convert it into a movement where she comes into butterfly, close her legs, and then gently open again. But make it and keep it a very gentle movement. Now, if she has any lower back discomfort, a slight cushion or even her hands can be kept underneath and then do it. This can be more comfortable and supportive to the lower back while practicing this. And that's it. And especially in the third trimester, to come out of asana, always ask her to turn to one side gently, take support of floor, come up into sitting. It's important to be mindful of the space for the belly. Always remind her if any point in time she's uncomfortable, she's feeling dizzy, to come out of asana. And do not recommend it if she has high hip pain or very high pelvic pain. So in that case, she can avoid or do certain variations of this. Thank you.